I think you can take that. Hi, everybody. My name is Andy Shin. I'm from the CMS Innovation Center. I'm not Will Yu, in case it's been a little dark in here. Thank you so much, Bart, for that great presentation. Next up, we have Tyler Huehmer, who's the director of Critigen Labs, Critigen, and he's here to present an app called Health Indicators, which is a easy-to-use dashboard app that transforms complex health data into geographically relevant, timely, and navigable information on a map-based interface. So, Tyler, take it away.
Thank you. So, good afternoon. I'm Tyler Huehmer, and I'm thrilled to be here presenting on behalf of Critigen Labs, a research and development team at Critigen. Now, Critigen is a spatial systems integrator, and we help clients and organizations of any size spatially enable their business. Now, spatial enablement is really not a new idea or a concept. In fact, the increase in GPS technology has also increased the use of location in existing industries, and health is certainly no exception, especially now that data is being made freely available to the public. Now, Health Indicators is a mobile spatial dashboard developed using Esri's runtime SDK for iOS. It was really developed to illustrate how mass amounts of information could be repackaged, bundled, and prepared for quick executive display anywhere, anytime. Now, Health Indicators began with data released by the Community Health Status Project Working Group, and in particular the CHSI data, or the Community Health Status Indicators. And that was made available as part of the Health Data Initiative. And what we did is we took that data and we put it through what we called the data grinder, whereby several data sources and geographies were aggregated together. In fact, several hundred health indicators were filtered down and aggregated together to create something meaningful and actionable. So this automated process, again, it utilized Esri's ArcGIS server and geoprocessing tasks to aggregate health information, generate data categories, as well as calculate role information from the county to the state level, compute percentage of reports, as well as format the data for user-friendly display. And we also derive sentiment. So is the data good or bad? Really, what is the data telling us? Now, these automated tasks are also something that we can use as data becomes freely available in the future. And what this allows us to do is incorporate new data sets as well as trend data over time. This really opens the door for a whole new set of applications in the future. So in 2009 at TED Med, Bill Davenhall told the story of geomedicine, and he asked a simple question: how does geography impact your personal health? Now, these stories are still being told today, and Bill and Esri with their My Place History app has certainly illustrated how geographic information systems, or GIS, can be used in the health industry. So Critigen Labs set out to develop a mobile dashboard for executives. So we found out that the CHSI data was available. We thought of the geomedicine story, and very quickly a new story emerged about health and geography and the need to quickly access information. And from this, Health Indicators was born. Now, it's really a dashboard for executives or elected officials. So in this hypothetical example, Secretary Sebelius is preparing for the National Association of County and City Health Officials in Lawrence, Kansas. Now, while we know she's familiar with the area, she still needs up-to-date access to information. So Health Indicators is an application that allows somebody to use GIS without knowing it. It provides the ability to quickly and easily browse through large amounts of information without any knowledge of data sources, database queries, summary statistics, or even how to use a complicated UI. So through informational design and the integration of GIS, we're able to visually access data that was otherwise difficult to access or difficult to understand. So this exploratory tool enables someone to browse information geographically and focus on what's important, and that's what is the data telling them. So this really enables an executive or an elected official to make decisions. And this might be a change in funding focus, a policy change, additional data liberation, or it might be as simple as figuring out where to hold an event based on how well a specific indicator was reporting. And with that, I'm going to go ahead and jump into a live demonstration of the application. So as mentioned, it's an iPad application. It's available in the Apple Store. It's an executive dashboard. Give the internet a second to connect up here. And very quickly, I can go along the bottom and just map specific health indicators. So what we've done is we've grouped health indicators into 6 major categories along the bottom. So we've got good start, staying healthy, managing disease, preventing disease, getting help, and paying for care. Now, this information is stored in what we call a pod. Now, pod's a number of things. It could be a grouping of health indicators or a data category, or it could be a health indicator itself. So in the example of Good Start, I can just tap the icon and quickly map the results. I can also interact with the map to drill down. And I can click the back arrow, I'll drill back up. And I can see the numbers that were reported, and equally as important, I can see the percentage of counties reporting for a given health indicator. Now, if I tap the pod, I can see information about the data set. So I can see the range of data, of course, what was reported, and the standard deviation. Now, this is important when we start to compare data. So I can also drill into a particular data category to see what it's composed of. So Good Start is really about getting a good start in life. So a good birth weight, for example. And within those categories, I can simply just click on the button and quickly map the KPI. Now, I can also click on the I here if I want more information about the category or if I want direct access back to the original data sets. So just as data was aggregated together in data categories, it's also rolled up in geography. So I can actually interact with the map and drill down to see how a particular KPI has rolled up from the county. So in this example, I'll go ahead and look at managing disease, and I'll look at infant deaths. And just with the click of a button, I'm able to see that North Dakota is actually reporting higher than the national average. So I'm going to go ahead now and drill down into Kansas, and I'll use that hypothetical example of Secretary Sebelius. And I'll go back up, look at quick facts. I drill down into Good Start, and I can look at low birth weights. And just using a pinch, I can zoom the map, and very quickly I can see a variable data set here. I'm going to go ahead and click on Douglas County, and I can see how that's reported versus the national average. So we can see that Douglas County is doing well. Now, equally as important as where data is being reported is where it's not being reported. So I'll go ahead and look at a different KPI. I'll give myself a little bit more real estate by doing a single finger swipe down. I'm still reporting the national average and of course the average for Kansas. But here we can see a lot of red question marks. And here we've got a data discovery tool that's showing us where data doesn't exist. So again, for Douglas County, I can go ahead and see how well that's reporting. Click on it again, and we can see that it's in fact lower than the national average. So as well as the grouping of health indicators into these categories, health indicators have also been aggregated together. So in this case of injury and homicide, we may not be interested in mapping motor vehicle accidents, but we are interested in the total injury and homicide deaths. So that's how we've aggregated data together. Now another example of that, I'll go ahead and map cancer deaths, cancer deaths, and click on a different county, and I can see that, compare this to the number reported for Kansas, I can actually see it's much higher. If I go ahead and click on that again, I can see that the value reported is almost 2 times higher than the national average. So there's a point of action. Why is that? And we start to have questions. If I tap on it again, I can see the composition for that particular health indicator. So I'm going to go ahead and walk back through the geometries, and here I can just click on health indicators and jump to the top level. And I'll go ahead and drill down and we'll take a look at Maryland. Again, I can zoom in and I'll just tap the state. Go back up, and this time I'm going to look at staying healthy, and I'll map low education. Now, here's an example where we've got a geographic feature that's separating values. So we've got values of low education to the west of the river, and so we've begun to see things that were otherwise obscured in a regular report or database table. So we may have questions now, and I can go back and drill up and say, well, why is that? So I might want to look at something like the population in poverty to see if that's a factor. And in fact, it's not. People are actually doing well in this area. And interestingly enough, if I look at government beneficiaries, I can see that there's actually a high number of people that are receiving Medicare or Medicaid support. And again, I can drill down into that, and I can see the values and distributions for how that help is being given. So at any time, if I have my location services enabled, I could go and show where I am in the map and have it drill down to that specific county, as well as I could go ahead and click on the About, get some contact information, as well as a walkthrough that kind of goes through everything that I've demonstrated. So I encourage you to go out to the App Store and download it. So to me, what's interesting about this is what's next. So I've demonstrated this application a number of times, and it's quite apparent that people react to information displayed spatially or on a map. It's different. It's intuitive, it's easy to use, provides quick and easy access to data, but it does something else. It provides insight that was otherwise hidden. So by displaying it geographically, we get information that we didn't have before. Now, any data set could be integrated into this application that's geographically relevant to bring additional use cases to the application. So think of census data being an example of that. And from that, we get a whole new set of applications in the future. And it's for these reasons that we really need to continue to make data publicly available. You know, there's a whole new wave of applications coming, and Health Indicators is one of the first apps to visually show data that nobody knew they had. And with that, I'll say thanks and just open it up for any questions. Thanks. Okay, thank you.